Good afternoon, Public Health Department. Today we're going to give you an update on the coronavirus, the COVID-19. Today we're going to have first Mayor John Cooper. He will be followed by Dr. Michael Caldwell, and then Dr. William Schaffner, and then Dr. Alex Jahangir, who is our board chair. And then afterwards, we're going to open it up for a few questions. And so with that, I'll introduce Mayor Cooper.
Oh, promoting me. Okay. Thank you all very much for being here. We're here today to provide an update on how our city is responding to the coronavirus. Now, this is an unprecedented moment. We're really confronting two challenges at once. Last week's tornado and now this, the coronavirus. I want the victims of last week's tornado to know that the Metro government and the entire community is committed to helping us recover and rebuild. 3 disaster assistance centers continue to operate to help answer questions and connect you with FEMA resources. We are making progress. Metro Public Works has cleared 92% of all blocked roadways, 100% of all blocked alleyways, and repaired 94% of all down traffic signals. NES is working to address less than 300 remaining customers without power. Now that is down from 50,000 on March 3rd, so that is a lot of progress. My office has coordinated with local utilities and telecom providers to provide billing grace periods across the county to help ease financial burdens brought on either by the tornado or coronavirus. Now, last week we saw how Nashvillians responded to the tornado. We came together as a city. Now we are facing another challenge, one that will require an equally strong response, but in a different way. And that response is already underway. This afternoon, I brought together our Public Health Director, Dr. Michael Caldwell, the Chair of our Health Board, Dr. Alex Jahangir, one of the nation's leading experts on infectious diseases, Dr. William Schaffner, to give us an update on our citywide response strategy. We have the resources to meet this new challenge. Nashville is America's healthcare capital. Our city has some of the brilliant medical minds anywhere, and Metro is working to ensure that our response plan is an amended capital spending plan to the council that includes additional funding for repairs to tornado-damaged buildings and contingency funds for dealing with the effects of the coronavirus. The virus, of course, is having an impact on our local economy, which will lead to lower tax revenues, particularly related to sales and hotel tax collections. We've been taking this particular challenge into account over the past several weeks as we formulate the budget and our financial projections. For weeks, my office has been getting regular updates from the health department on the state of readiness of our coronavirus monitoring and response team, and this week we've been involved in White House briefing calls with state and local governments. We've also convened a meeting with the leaders of all the hospitals, and Dr. Jahangir, who's also the head of our Public Health Commission, will talk more about what we're doing with them and with our state and national partners. I also named Dr. Jahangir chair of Metro Virus Task Force, which will include leading clinicians, epidemiologists, and other community partners from both Metro government, educational institutions, hospitals, and other important stakeholders from throughout Nashville and Davidson County. As Executive Medical Director for the Vanderbilt Center for Trauma, Burn, and Emergency Surgery, Dr. Jahangir is a respected surgeon and an organizational leader, and the Metro Coronavirus Task Force is in excellent hands under his leadership. Now, Metro government, schools, and businesses across the city are already taking round-the-clock cleaning program and stands ready to implement any additional operational changes as directed by medical officials. Now, prudent measures are being taken to reduce the number of large public events as part of social distancing. Our health department is sharing information on how we could all protect ourselves from the coronavirus and what we should do if we are worried we have symptoms. You'll be hearing more about that from our three experts, Dr. Caldwell, Dr. Yanger, and Dr. Schaffner. And with that, I'll turn this event over.
Thank you, Mayor Cooper, and good afternoon. The Public Health Nashville Metro Health Department is now investigating a total of 10 Davidson County cases of COVID-19. We fully expect the number of cases to increase as testing increases. I'm asking everyone routine health precautions. This is especially important for those with any underlying health conditions and anyone and over. The best way to prevent the spread of respiratory viruses, first with water, then with soap, for at least 20 seconds. If that is not available, you can use a hand sanitizer as a backup. Touching necessarily. Try to your face. Please remove yourself from others as much as you possibly can. If you cough or sneeze, try to use a tissue and then immediately throw it in the trash. If that's not available, we advise you to use the crux of your frequently touched objects and surfaces. I also ask the community to find alternative ways to greet each other. You saw this here as we were greeting each other. We're trying to avoid public service announcements, which you'll see soon with my advice to both NASH and TRAC on what they can do. Professor of Preventive Medicine and Infectious Diseases at Vanderbilt University Medical Center. And I'm grateful that he's here today. Dr. Schaffner, thank you.
Thank you, Michael. Mr. Mayor, thank you. Good to be here with all of you. I'd like to say a few words. Earlier this week, for example, the World Health Organization actually declared coronavirus 19 a pandemic. It's a word that should not evoke panic. It's a pandemic because institute a vigorous response now, we can dampen the outbreak. That's the first goal. Dampen the outbreak, spread it out so that there's not a huge surge of medical care need at one time. If we can spread this out, we can take better of everyone. The other goal is to reduce vulnerable. The most vulnerable population are those who get older disease, chronic illness related to heart, if you have diabetes, or if you're immunocompromised in any way. So we're trying to minimize the spread of the virus to those people. This disease yet, so we have to do traditional and public health, that is to try to prevent the spread. This is a respiratory virus, and I breathe out microscopically. There will be viruses in what I exhale. If you're within 3 to 6 feet of me in what's called the breathing zone, and you inhale, and I hope you do, then you'll obviously inhale some of what I've exhaled, including the viruses, and they can be spread to you, and you can become ill. So the notion is, let's keep as much separate from each other so we don't infect each other. We'll reduce the risk of transmission in the community. That's called social distancing. We do it professionally at work, also do it personally. And the easiest way to do that, it's easy to say, more difficult to do, is to avoid large group events, whether they are religious events, entertainment in the country. I'm impressed at how this has been accepted. Businesses, religious organizations and facilities are now either closing down or making meetings not in person, but virtual. That's one way we can get space between us. In our own homes and in our own personal activities, it's similar. I'll give you an example. My wife was called by a friend of hers and she was overseas, and asked whether she should attend a dinner, a celebratory dinner. I think it was a birthday dinner. 30 people would attend. Should she attend it? Isn't everyone who attends that dinner going to be over 60? So the question is not whether so-and-so should attend that dinner, but whether that dinner should be held at all. Because that's bringing a group of people who are all in the more vulnerable group together, face to face, in an enclosed room for a rather prolonged period of time, about 3 hours. That's exactly the kind of circumstance that we need to postpone today. The opportunity at the dinner, we're carrying the virus, spread it to everyone else. So let's keep things apart. We'd like to create Nashville as a hug-free zone for a while, so that we're all kind of elbow bumping, but hugging and kissing large numbers of people. Let's postpone that for a while. Businesses are minimizing, particularly if you're in a vulnerable group. Be reverent at home is my suggestion, rather than joining the congregation for a few weekends. I think it's safe to go out in restaurants because you're there with just a friend or two or three, and that's a small group. We don't want everyone to go home, lock the door, and crawl under. Make reasonable adjustments to our personal lives. Go outside, get a little exercise, take a walk, enjoy yourself, enjoy life, but be prudent. Thank you very much. Dr. Janiger.
Thank you, Mayor Cooper.